This one's modified bed bath, so you only have to, or partial bed bath, you only have to wash the face, the neck, the chest, the abdomen, the arm, armpit, and hand, and back. You're only doing one side for state skill purposes because you're just demonstrating that your technique. So clearly when you give a patient a bath, you're going to bathe both sides. But so the supplies that I've already pulled, I've got about 4 washcloths, 2 towels, a pair of gloves, got a clean gown, which I'm going to put my gown at the foot of her bed so that it doesn't get wet. I've got soap, hand lotion. I've already got my water, I've checked the temperature, and of course I've already knocked, introduced, provide privacy, wash my hands, all the usual things that we do for everything. The temperature felt good to me. Ms. Felicia, if you'll check the temperature of the water for me. Good? Yeah? Okay. All right, so the very first thing you do when you give a bath is you remove the gown. So I'm going to go ahead and get you undressed, Ms. Felicia, okay? And try to not overexpose your patient. Keep them under the covers as much as possible. There's no way to not expose your patient when you're giving them a bath. There's absolutely no way. So, roll the gown away from you and throw it into the hamper. Okay, so in real life, we would probably change the sheets when we give a bath, but they're isolating the skills, so we're not changing the sheets, you're only doing the bath. So for that reason, we're not going to get the bed wet. So we're going to be using towels to kind of preserve the sheets in areas that could get wet. All right, so I'm going to go ahead and put on my gloves. So when we wash the face, remember your IC skills, you can offer your patients choices. We're not supposed to use soap on the face unless the patient wants us to use soap on the face. So as IC points, you can ask the patient, do you want me to put soap on your face or not? Okay, and that might give you some brownie points. So, all right, Miss Felicia, I'm gonna wash your face. I don't have any soap on here, is that okay? Oh yeah, I don't want soap. Okay, so I'm gonna clean her eyes first. Close your eyes for me, and you're gonna go from the inside to the outside and change the surface of your washcloth and go again. Close your eyes, inner to outer, and then use the rest of your washcloth to clean the forehead, the cheeks, the nose, and the chin, and the neck. Okay. And then you're going to use your towel to dry the face. Because we're going to do her arm next, I'm going to put this towel under her arm. I'm going to put this side rail down so I'm not working over it. And you can use a bath blanket if you want to pull all these sheets down and just put a bath blanket on her, so that bath blanket, if it gets wet, you're just throwing it in the hamper anyway. But I think we'll be okay like this. So I'm going to get a washcloth. This one's going to have soap. Soap. Remember the 4 surfaces of your washcloth. For every surface of the body that you wash, you should change the surface of your washcloth. So we're going to go from the shoulder down, make sure that you're supporting the arm. Don't forget the fingers and the hand. Turn your washcloth over, do the underside. We're going to come back and do the armpit last though. And hand. Okay, so that one was soap. So we're going to keep our soapy washcloths separate from our rinse washcloths. So this one will be rinse. Same exact thing you just did. See how you're rinsing from the shoulder down to the hand and the fingers. Change your surface, rinse underneath, rinse the hand, change the surface. All right, so this one's going to be rinse. So I'm going to use a towel to dry. Dry all surfaces. And now I'm going to go ahead and do her chest and abdomen. I'm going to put a towel there just to not overexpose her. So this one was my soap. Put more soap on there if you have to. Now we're going to do the chest. Again, there's no way to not expose your patient when you're washing them. And abdomen. Okay, so that one was soap. Now we're gonna rinse. And of course you can change your water anytime it gets really soapy. You could also use 2 bath basins if you want, one for soap and one for rinse. Your water will actually go a longer way when you do that. And I'm gonna dry. Okay, Miss Felicia, I'm gonna roll you over so we can get the back of you, okay? I'll just leave this towel over her, and on 3, 1, 2, 3. Make sure your patient isn't too close to the edge of the bed. You already had this towel here, you can kind of put it underneath so that the bed doesn't get wet there. And get your soap. Soap, just a hint when you're doing this for state, don't use a lot of soap. Don't use a lot of water or your basin's gonna have to be changed. Wash the back and the back of the neck. You don't have to wash the buttocks or go any further for this one. It's just, it clearly states the back. So that's what we're doing. And now rinse. And then we'll dry. Towel's already there. And I'm gonna get some lotion. And for this one, it states to warm the lotion in your hands and massage the back. You want to make sure that you're not rubbing any any reddened areas, because you don't want to make it worse. So I think your prometric skills checklist says to go in circular motions and then straight lines. Use your towel to wipe off any excess lotion. We did not get her bed wet. Okay, I'm gonna roll you back over. Covered. Let me go get rid of all my dirty stuff and I'm going to come back and get you dressed. Okay, because, I gotta get her armpit. When you had her turned over on her back, get that armpit last. Wash, rinse, and dry. And state makes no mention of using deodorant, but please use deodorant on your patients because they do get body odor. Okay, I'm going to go ahead and take care of this stuff. And like with everything else, always rinse and dry your basins. It goes in the designated dirty area. I'm going to put another paper towel, clean my table. Gloves off, say wash hands. And now I'm clean. I don't need gloves for this because it's casual contact and everything you're touching is clean. She had a nice clean gown. The easiest way to do this would be to tie the front. And flip it over. Okay. Make sure that your patient has her call light in hand. All clean. Let me know if you need anything, okay? Okay. Wash hands, still complete.